Hello and welcome back to Focus Atlanta. Again, I am your host, Keisha Lancelin. Thanks so much for continuing to watch. In this segment, we're going to talk about Black maternal health. I'm here with Iris Hamilton. Iris, thank you for making time for us here in Atlanta.
Thank you for this great opportunity to speak with you in regards to such a wonderful topic.
Well, let's talk a little bit about some of the numbers. We've consistently seen that Black maternal health numbers are not great here in the state of Georgia. Can we discuss that?
Absolutely. I'd like to say every year, approximately 130,000 Georgians discover that they're pregnant. Roughly 70% will experience healthy pregnancies. Unfortunately, nearly 30,000 families, however, will experience serious complications during pregnancy. One of the most important facts that people need to understand is that many pregnancy complications develop long before someone feels that they're pregnant or begin showing. Almost 90% of adverse pregnancy outcomes could potentially be prevented through timely medical care and early intervention. The challenge is that most women do not realize how quickly the clock starts. And that's what we'll talk about here today.
At one point, we thought that only these issues were happening in rural America, right? But now we're seeing the numbers that metropolitan cities, are having just as terrible statistics or just as, horrible outcomes as those rural areas. What should we know?
Most people believe they're about 1 week pregnant when they miss their first period. Medically, they could already be about 4 weeks into the pregnancy journey. That means that women often have a short window to establish prenatal care before fetal development and important maternal health changes are already underway. For example, during those first weeks, the baby's brain and spinal cord begin developing. The mother's cardiovascular system begins to change. Previously undiagnosed conditions such as hypertension or diabetes starts to affect the pregnancy. So waiting 8, 10, 12 weeks can mean losing valuable opportunities to identify and manage risk very early in the pregnancy. So I would say by the time you think you're 1 week pregnant medically, you are already about a month into that pregnancy journey. And so that is really key for the moms, whether it's in rural Georgia, metro Atlanta, urban, everywhere. It makes a difference. We have to make sure that we're taking action very early, as you know, that you can during that pregnancy.
And once we are in a position to get the help that we need, we know that we're pregnant, the ladies know that they're pregnant. Can we talk about the staffing shortages that we've seen a little about in the media? How does that impact maternal health?
Absolutely. So based on, there are some misconceptions in regards to delay of care. Actually, there are staffing shortages that exist. So what we are asking our moms to do or women to do is that, some of them say, I'll wait until I'm sure, I'll, call after I take another test. Sometimes they want to take multiple tests. Also, I'll make an appointment once I start to feel pregnant. Because of some of the shortages, you have to really act early. And so, unfortunately, pregnancy does not wait. If you're pregnant, certainly are thinking it's even a possibility, begin taking over-the-counter prenatal vitamins with folic acid immediately. It won't harm you if you're not pregnant, and contact a healthcare provider immediately even if you're not sure, because there can be some delays in getting in for an appointment. And we'll talk about that early as well. Early conversations save time and potentially save lives.
Iris, thank you so much for making time for us here in Atlanta. We got the website there for more information. It was a pleasure to meet you.
Thank you so much.
All right, guys. This is an issue that we've been dealing with statistically for quite some time. The issue of Black maternal health. Please take the opportunity to learn more, get the information that you need, so that you and your baby and your family can stay healthy. Thanks, guys, for tuning in to this segment of Focus Atlanta. We'll be right back.